I know there have been figures that have been mentioned about the modelling of, at the peak of this in 2022, what number of cases we might have. And that looks like for the northern region around 5,300 cases of COVID-19 per week. The important thing about that is it's predicted that 5,270 of those cases will be managed in the community. What that community care looks like, the Minister has talked about, but essentially it starts with a positive case being identified. That may be at a COVID testing station, it may be at a respiratory clinic, at a general practice, or a surveillance swab. That is then notified to public health, and the public health do then 2 assessments of that patient to define their risk. One is their medical risk, which is based on ethnicity, age, and other medical conditions that that person may have. It also looks at the social risk of that patient. Are they able to manage or self-isolate at home? Are there needs for their family in terms of food, clothing, education? So public health will look at those patients. Then those patients will be risk stratified clinically to decide where can they be safely managed. And 90 to 95% of people who get COVID-19 will have a mild to viral illness which requires no treatment but will need monitoring, usually at home. I say 90 to 95% because we can alter those figures with high levels of vaccination. So that's still the job at hand that we need to make sure we're onto. So a lot of planning has gone into how this will be managed. The majority of patients will be looked after in primary care. But the job at hand, because we can still minimise the number of people who A, get COVID, B, suffer the serious consequences, vaccinate, and I would encourage people who haven't to make use of Super Saturday coming up this weekend so that we can really get vaccination rates up as high as we can. Kia ora.